I believe very strongly in our role and the responsibility of advancing a patient-centered care delivery model. What motivates us to do the work that we do each and every day is our own experience as a patient and as a family caregiver. As part of that, health plans are in the unique opportunity of being present for most of life's most important and most vulnerable moments. That puts us at the forefront of driving the changes that will improve patient care at all stages of life. And you're going to hear about that later this afternoon. These efforts will have a profound impact for our consumers and for the country. Only health plans are equipped to see across the entire system. We are in a position to translate this vast array of data that exists about procedures and providers and turn it into something understandable and usable for patients. It is why we can be the consumer's best choice and their best advocate. We can make sure that they have the information they need to make informed choices at the right time. We also need to provide good choices in circumstances where they have to trust the system. That starts by moving forward with consumer-friendly approaches that simplify the healthcare decision-making process for families. By giving patients information at their fingertips, we are eliminating many of the barriers that have obstructed our path to a better health system. I am proud to say that today, virtually every health plan now offers simple and innovative cost and quality tools to help inform consumers. And I am confident that this is an area where we can accelerate in the years ahead. In fact, many of the individual sessions over the next 2 days are tools to help you get started or improve that process. If we are to be successful in managing cost, we can't just have a single actor out there standing against the tide. We are going to need to change the direction of the tide. We need to get everyone working toward a common goal of achieving value rather than working to maximize volume. Our job as an industry is to bring physician practices, hospitals, pharmaceutical companies, and ultimately consumers along with us on this journey. Just this year, we announced the release of 7 core sets of quality measures for various health conditions, including hepatitis C and cardiology. By aligning these quality measures and reporting them across the entire health system, we can start to identify gaps in care and the steps that we need to take to improve care delivery. This work is fundamental to all players across the health system, and we were proud to work side by side with the Centers for Medicare and Medicaid Services, primary care and physician specialty groups, consumers, employer groups, hospital groups, and more. The key to allowing these innovative partnerships to flourish is to recognize that healthcare goes beyond a solo visit to a doctor's office or a single prescription filled at a pharmacy. By providing care coordination and disease management services with community organizations, such as local churches, food banks, or transportation centers, Medicaid plans are able to design specific programs that meet the needs of specific patient population, such as mothers-to-be. Our plans have made smart, innovative changes like integrating behavioral health and physical care, even combining the two so that primary care services can be delivered in a behavioral health care setting. Again, this works for the patient and it works for the healthcare system. As state and policymakers consider new reforms to the Medicaid program, we need to ask people to look beyond their old basics and beyond labels. In the months and years ahead, AHIP is going to be increasingly vocal about that value, the value of Medicaid managed care and what we deliver for beneficiaries. We will partner with government to serve as the catalyst for movement from fee-for-service to care coordination results, just as we have done with the Medicare Advantage program. Medicare Advantage has proven its value over and over again, and more seniors are choosing it every year, or as I would say, they're voting with their feet. They're voting to join the program, and they're very vocal about their support for the program. It is time that the country recognize that fact and that we have a different discussion about Medicare Advantage. That conversation starts by asking what approach delivers the best care for patients and moves the system towards sustainable financial footing. Medicare Advantage is the program that continues to lead in this regard. The role of AHIP and my role is to make sure we provide a voice for the work that all of you are doing to make the health care system better. And just as important, how deeply committed you all are to improving the health of the whole country. I am very proud to represent this industry, energized not only by our innovation, but by our spirit, and excited about what comes next.